procedure, you have to have a doctor's order, and you need to verify the order before you do anything. Okay, so for placement of nasogastric tubing, you need to get a doctor's order. Okay, so the first thing, you check the chart, okay, and you make sure you have the right order, and then when you enter, excuse me, the patient's room, of course, beforehand, you wash your hands, universal precaution. You go ahead and you introduce yourself to the patient if you haven't done that already. And what is it that we do? Next thing, you should know that by now.
Check name tag.
Check the wrist, yes, exactly. Check the ID band to make sure that you have the correct patient, and make sure that you check the correct chart. So you can bring the chart into your room to check the information that you have on the chart against the patient's wristband. Okay, and after that, you talk to your patient, and you need to obtain his or her verbal agreement. There is no written consent that is involved at this point, but you explain to them the procedure and you ask their permission to proceed. So make sure that you explain everything thoroughly and using plain, simple English in layman's terms, if you will, so that they understand what you're talking about. Two clear indications for insertion of nasogastric tubes are when, number one, the patient, as a result of some medical illness, experiences impaired swallowing. They partially lose, or completely lose their ability to safely swallow food and liquids. Let's say a patient has experienced cerebrovascular accident, and excuse me, that's a very common outcome. Impaired swallowing is a very common outcome and problem that is associated with CVA or cerebrovascular accidents. For short-term nutrition, we usually insert after the patient is evaluated and determined that it's appropriate for nasogastric tubing insertion. We go ahead and insert the NG tube, which is short for nasogastric tubing, and we start feeding the patient until we can further evaluate the patient to see if they regain, any of their swallowing ability, if they become better, and the impairment gradually resolves. And if they're on the right track, then that's good. So eventually, at some point, we can, discontinue the feeding and assess them again and let them eat, on their own, feed just regular food, solid food, and thin liquids. But also sometimes patients develop severe nausea and vomiting and abdominal distension. Like you said, you saw in the video, there were a few indications like ileus, for example, as a result of GI bleeding, acute GI bleeding or acute gastrointestinal bleeding. They develop severe nausea, vomiting. They vomit repeatedly, and obviously they can't drink or swallow or eat anything, and their abdomen becomes very distended. It's painful. So in order to provide them with some relief, we insert nasogastric tubing, which at that time is usually connected to a suction system, and the doctor determines how often the suction needs to work. Is it intermittently? Is it continuously? And either way, what the suction force should be. That is all determined by the physician. Now, but again, like I said, this information is for you, for future reference, so that you know some of the indications of NG tube insertion. The two nursing diagnoses that you can think about, and during your practicum you can use. You can come up with other nursing diagnoses too if you like, but the ones that I'm going to mention now. The first one can be acute pain or acute abdominal pain related to abdominal distension, nausea and vomiting, secondary to acute GI bleeding. So GI bleeding is an accepted medical diagnosis. And then the second one is alteration in nutrition related to impaired swallowing ability, secondary to cerebrovascular accident, for example. Okay? So these are two nursing diagnoses that you can excuse me, use here in your practicum, or you're more than welcome to come up with anything else that you might like. Now, so we paused a little bit in between, and I gave you all this information. So going back to our patient, assuming that the patient has given his or her verbal consent and they have completely understood what is it that you're talking about and you have answered all of their questions, you go to your medical supply room, gather your supplies, which really, is not much. I think this procedure is easier as far as the technique and supplies are concerned, because then the wound dressing change. The technique is non-sterile. You don't have to worry about using sterile technique, because what you're dealing with is the GI system, right? And we're putting food in our mouth all the time. The food is not sterile, is it? Okay. So what we need is, number one, we need an NG tube or nasogastric tube at proper size. And they vary in size. The smallest one is 8 French. I try to go with the smallest one that can serve as a feeding tube, is large enough to serve as a feeding tube. The lumen is not very narrow. And also it's small enough to slide down through the nasal passage and the esophagus with least convenience to the patient. So it's a little bit tricky, but you need to use your nursing judgment. And sometimes you can ask the doctor. Actually, a lot of times the doctor determines what kind and what French. There's another one that was not mentioned in the, well, it was mentioned in the video, but briefly. Excuse me. The Dubhoff, is spelled D-U-B-H-O-F-F, is an opaque tubing. It's very tiny, and it comes with a stylet or a guiding wire inside, which makes it very easy to insert, but it's very tiny. So it's usually not an ideal choice or the best choice for feeding, because the tube after insertion has to be connected to an adapter and then to a feeding pump. So you may have a bit of difficulty finding the right adapter, but it's very easy to insert. And after it's inserted, like the other tubings that you saw that came with the stylet or the guiding wire is removed. But that is usually after the chest X-ray is taken, which is the ultimate and the best way of verifying correct placement. But we will get to that in a second. I just wanted to mention that there's another type of tubing that's called the Dubhoff. So saline sump and Levine tube and the Dubhoff are some of the choices that you have. So we have our tubing. We usually get, and that they usually come in this packaging. So this is saline sump, and it's French 12, which is not very large. So this is the packaging that looks like. And then we usually have an irrigation tray, and the irrigation tray comes with this container and a syringe in it. And you want to make sure that your syringe is operating okay. You want to just cut a few pieces of gauze. I'm sorry, not gauze. I'm sorry, a few pieces of tape for later use. Just keep it handy. Now, we are inserting an NG tube with minimum equipment, really, and you don't need to have a lot of items on your tray. And of course, you want to have a basin and a towel. Karen, would you mind, please? I need a towel and a basin. I have the basin here. Let me go get it. I got it. This is the irrigation tray, actually. Let me open it for you so you see. This is what it looks like. So it comes with a pad and one alcohol pad, and exactly the same container in the syringe that you see here. So these are irrigation trays. And then you want to have, this is a big basin, usually smaller basin will do. And we need a water